invitation. So yes, this morning my role is to speak a little bit about the main evidence and results about the sustainability in CHRODIS Plus. And I have to say that frankly, I will repeat most of the words that were already presented by the previous speakers. Okay, so I have no surprises for you. Okay, and so I think that this is something that we needed to discuss in the round table. Okay, as a last session, because basically you already listened some of the challenges about the sustainability, about the transferability, and those challenges and lessons learned are also the ones that I'm going to present you in that where the results of the CHRODIS Plus, that as you can see from the first slide, was a joint action, just for the ones that were not involved, that started in 2017 and was closed in 2020. Okay. And just a few words about this joint action. So was a joint action on chronic diseases, and about implementing good practices or best practices, how we want to call them, and it was based on a previous joint action. So this joint action was CHRODIS Plus because it was the follow-up joint action of the previous one that was the joint action CHRODIS. Okay, and the best practice that were implemented in CHRODIS Plus were the best practice that were analyzed in the previous project. So we had 21 implementation sites, 21 pilots, implementing good practices in 4 areas: health promotion and primary prevention, integrated multimorbidity care, the quality care for people with chronic diseases, and chronic disease management in the working place. Just other few words about the good practices that were implemented. So in the area of the health promotion and the primary prevention, we had 4 good practices. 5 good practices. So the Lombardy Workplace Health Promotion Network, the Active School Flag, the Jog practice, Toy Box, and Successful Aging. Then the integrated multimorbidity care model implementation that was implemented in 5 pilot sites. And then the quality criteria and recommendation tools that also was tested in different in different settings. And the last but not least, the good practice on in the workplaces. Basically, we had 2 practices. The first was a training tool for managers, and the second one toolkit for improving well-being and health and work participations. Okay, so as I said, nothing new and no surprises for you. In these slides, I try just to summarize the main evidence from the pilot implementation. So from the implementation perspective and the experience that we had in the different pilot sites. So Sorry for the repetition, but maybe it can be useful then, as I said, for the roundtable. First of all, from the point of view of the integration of those good practices, of course, I have to say, the involvement of key stakeholders was an important issue, as the use of effective communication channels, and a third pillar for an effective implementation was the alignment between the best practices implementing and the already existing policies. From the point of view of the sustainability mechanisms, of course, to find the right funds, the resources was a key issue, especially in a long-term perspective. The institutional support of all the institutions and the institutional body involved in the implementation. To have a specific workforce dedicated to the implementation. Some of the speakers previously mentioned the workforce and the workforce shortages as a challenge for an effective implementations. And I would like just to point out on the last point of this second pillar, the policy dialogues, that actually were one of the success factors in CHRODIS Plus. We had one policy dialogue in each country that was involved in CHRODIS Plus, and two European policy dialogues. These policy dialogues, we had a methodology for management to manage the policy dialogues, a methodology that was provided by EuroHealthNet, and we had a very good result. So if I have to point out from between all these factors, one of the most important was really those policy dialogues. Maybe we can discuss a little bit later during the roundtable about that. The third pillar was one of the focus for the CHRODIS Plus joint action on the sustainability, so the EU added value. Okay. And we highlighted the importance to exchange the knowledge, to exchange the good practices, to harmonize the regulation between the countries, between the member states, and to foster the cross-sectoral engagement in order to boost efficiency and innovations in the different settings. About the policy and the community engagement, for sure the health in all policies issue was a successful factor, as the intersectoral collaboration in particular to have a comprehensive prevention strategies. About prevention, talking about the management of chronic diseases, CHRODIS Plus joint action really highlighted that prevention and promotion strategy is really the most sustainable way on which we can manage the chronic diseases. So health promotion, primary prevention, patient empowerment, okay. And what's important, to embed all these policies in different environments like schools and in workplaces. Okay. Now I have the last 3 slides are here to describe what are the main recommendations of the CHRODIS Plus about the sustainability mechanism. So again, I'm going to repeat some concept. So about the involvement of key stakeholders, the CHRODIS Plus recommendation is to try to involve, all the stakeholders, not only in the health sector, but also in other sectors, and try to have those stakeholders involved in what we call the local implementation working groups. Okay, that we find out that were really an efficient way to have good results from the implementation. About the intersectoral collaboration, the recommendation is to establish collaborative framework, okay, to formalize the collaboration between different sectors. So it's important also the formal part, not only the practice, but also to formalize those networks, and as I said, involving also non-health stakeholders. About the resources, the recommendation of CHRODIS Plus was to engage funding bodies and also to try to create the synergies between the different funding sources at the EU level, national level, regional and the local level, and talking about the EU funds also to use in a synergic way all the different possibility and options that today we have with the different programs funded by the EU Commission. Other three recommendations about those three factors, institutional and governance structures. The recommendation was to integrate the successful pilot practices into existing healthcare system and policies, and this is really key, just to avoid that the pilot experience remain as a sort of experimental experience, one shot, and then when the project will close, also the pilot will end. Okay. Very important, also from the workforce perspective, the capacity building and training. Here, the suggestion and the recommendation is to develop training programs, okay, to improve the capacity building of all the stakeholders involved in the practice, and especially also the citizens and the patients, in particular for the training in using the digital tools. That driving decision making and monitoring. Of course, we are all aware of the importance to have the right data to measure the impact of the pilot, and so here the recommendation was to create and implement a robust monitoring framework to measure the results of the pilot. Okay, this is the last series of recommendations, and so the last slides about the digital and technical infrastructure. Well, this recommendation maybe is taken for granted today because we are always talking and we are implementing our country's digital solution, but was not granted in 2020. So here the recommendation is develop and scale digital health solution. About the EU added value, again, maybe we already taken for granted, but it's important to continue to invest in EU-wide networks, joint action projects, or, for example, opportunity like this conference to exchange our opinion, to discuss about what works and what does not work. And the last one is about the patient engagement, the citizen engagement. And we always talk about the importance to have the patient in the center, to involve the citizen, but somehow maybe the risk is really to forget about that. And so the last recommendation is to develop the participatory approaches where patients and community are directly involved, especially because at the end, most of the pilots that we have in our projects are implemented at the local level. So it's important, of course, to have the national bodies involved, because of the national regulation and so on. But first of all, it's important also to involve the local communities. And yes, I say, well, this is just a final synthesis with all the most important items that I already mentioned. And well, that's it from my side.